why and when is a mental capacity assessment needed? A mental capacity assessment becomes necessary if there are concerns that a person is unable to make certain decisions for themselves because of a condition that affects their mind or their brain. Such a condition can be either temporary or permanent. For example, being under the influence of a mind-altering substance, being unconscious following trauma to the head, or due to a medical condition. Conditions such as mental illness, stroke, dementia, learning disability, Huntington's disease, autistic spectrum disorder can also affect a person's mind or brain. These are just a few examples of conditions that can affect a person's capacity. That being said, the fact that a person has a condition that affects their mind or brain does not automatically mean they lack capacity. Rather, if their actions, their decision making or lack of decision raises concerns, it would be appropriate to assess the person's mental capacity. Depending on the decision they are required to make, a formal assessment may be required. For example, if a person is required to make a decision about life-changing medical treatment, a formal assessment would need to be carried out and the outcome of the assessment documented in a report. On the other hand, if the decision required is one that is made on a daily basis, the person's support staff or relative can assess capacity when the decision needs to be made, and a note can be recorded in the person's file. Let's take, for instance, someone who lives in a care home who is showing signs of relapse in their mental health. He decides he does not want to take a wash and he will rather wear the same clothes he's had on for the past few days. Staff would have to assess the person's capacity and record their decision. Of course, staff will encourage the person to take a wash for hygiene purposes. But equally, if the client is assessed as having mental capacity not to wash, that would be the client's decision. If, on the other hand, the client lacks capacity, staff would have to consider how best the client can be supported in maintaining their hygiene and managing the decline in their mental health. In determining when to assess mental capacity, the Mental Capacity Act sets that this needs to be done at the time the decision needs to be made.